Hey guys, Dr. Ben Gallier here, author of the book Rebuild Your Brain, Stop the Damage, Start the Repair. And I want to go over with you today exactly what we're able to see with a brain map and if we can tell if you or your loved one is dealing with true ADD or something else is affecting their brain. So in 2013, the FDA approved the brain map as a diagnostic tool for ADD. What does that mean? Well, the FDA, big organization, for them to approve something, they have to go through the process. So the company that went through that process looked at over 12,000 brains and said, hey, these brains are all going to have these similar patterns to them, meaning they're easily going into a daydreaming state and they're having a hard time staying in a focused state. So we see that with two specific brain waves in there. This is very common. We see it with a lot of kids with ADD, ADHD, all types of different issues. And we know that sitting in the classroom, it's going to be like Charlie Brown and won't. You're listening to the teacher and just really not getting anything out of it. So what we know is if someone has that pattern, that's what all the research has been done at. They compared the brain training that we do and Ritalin, and they both decreased the amount of ADD symptoms. They stopped for 6 months. Ritalin went right back to where they started. The ones that had trained their brains maintained the symptom changes. So all that research is done on these ADD brains. But the great part is a lot of patients that we work with, a lot of kids or adults that we work with that have been diagnosed with ADD don't actually have ADD pattern. So maybe it's their alpha, which is their rumination, their anxiety, their worry brain is just going, and they're never able to stay focused. So there's a lot of different reasons why someone may be experiencing ADD. But if we just go in and say, hey, you've been diagnosed ADD, let's do ADD protocol, but that's not exactly what your brain waves are doing, then we're going to be on the wrong page and we're not going to get the symptom changes that we want. So the number one step to determining is it really ADD or what else is going on in the brain is to get the quantitative EEG to get the brain map done. Again, FDA approved as a diagnostic tool for ADD. So we can totally tell what's going on in that brain. We know if this is a good fit for the program and whether we're going to be able to help you or a loved one get your focus back, get your life back, and be able to tell, is this the type of care you need? So I look forward to seeing your brain, and we'll talk to you soon.